Much. If any other question, we can start on later. And can we go on to the next session, Dr. Khanna?
Yeah, we can. We just want to give thank you and thank you, Dr. McNamara, for coming here. We will proceed with this is a diagnostic angiogram. I'm just going to do it. I've just done one shot. This is, if you remember, this is the patient of stem cell, autologous stem cell therapy, which we did in our last course. And hello. This is a patient which we did in our last course of had severe Burgess disease, and he had an autologous stem cell therapy. Functionally, this patient has improved a lot. He had a claudication distance of less than 30 or 20 meters, and today he is walking 2.5 kilometers a day, and with that he is not only on dual antiplatelets. I have done an angiogram. Can you run this? I have done an angiogram for the below knee. He just had a below knee occlusions, and this is what we have. I don't find a lot of angiographic improvement or a lot of what I expected, a lot of blushing and new collateral, visible collateral formation. This is what I get. Earlier I was not seeing many vessels, there were just faint vessels there. But functionally this patient has done very well, and this patient actually, I'll show you the film, had a black, almost a near impending gangrene, and he had an earlier amputation, and now, focus on this, and now this patient is walking and the limb is quite stable, and the lesions have healed. So it's just to bring this question, we talk about the autologous stem cell therapy. It's still not validated as a standard procedure, but we find patients who have improved. In this patient, we tried a year back in the same meeting, and this patient functionally has done very, very well. But angiographically, this is the picture. I don't find much of collateralization as much as I expected. So I'll leave this question open to you, to Dr. Suresh, who has a very large experience, I believe the largest experience in the country on below knee intervention and also on stem cell therapy, to give us and enlighten us about this therapy, and also his comments whether this is the result which he sees after stem cell therapy, or it's better or worse than this. Last frame.
Stem cell therapy does affect, or just a strict control therapy with stop smoking, put a footwear on these people, Indians walk barefoot. That might itself help. So we don't know that yet. But I would try it on a case where you have nothing else to offer, because it's pretty harmless. We know that it doesn't cause any damage.
Functionally, I totally agree. This patient has been on a strict walking regime. He's stopped smoking completely. I myself do not know what has helped him. I kept him on a triple antiplatelet therapy for a long time, but now he is just on dual antiplatelet, and he's not on any other drugs. If you see the picture, I don't know whether you can see it on the screen. That was the previous picture with the impending gangrene, not this one, from the computer, and this is what we have today, the previous one.
Yeah, we could see that.
Just 1 second. Can we go to the computer picture? Yeah, so this was during the last case last time. That limb was quite, they had an ulcer, you can't see it very well. Can we play that? And then it was all impending gangrene. Today, if you see, the gangrenes have healed, his ungli chalao, he's walking, the motor movements are fine, and the skin color has also improved. So they do improve, whether it's because of lack of smoking and good exercise regimen, walking regimen, or it's because of stem cell, we don't know. And the other thing I would like, with this sort of vessels, I don't think in the best of the hands also, this may be a very great case for a below knee intervention. I can ask Dr. Daidudu's opinion or Dr. Suresh's opinion, and I believe we still in these sort of cases have the option of giving them an autologous stem cell therapy.